Throughout my medical training, I think every time I had interviews, I always wanted kind of a family away from home. So when I got here, I felt like everyone just made me feel like this could be my second family.
I was looking for a program where I really felt like a part of the hospitalist team, not necessarily just another trainee, but someone who kind of felt like a team. And here, everyone felt very close-knit and friendly and welcoming, and they were very excited.
I think it's nice. It's a small, close-knit community. We text all the time and email all the time, and I see them around the hospital and while they're on rotation and on electives. If they need to come to me with anything, they're welcome to, and they know that, and the same with Dr. Garber as well.
From the day I started, you already kind of start having those initial conversations with the program about what it is that you want for your career. For me, I think I always loved medical education. That came natural to me, but Dr. Garber has exposed me to so much more than that, just training here. He is like the quality improvement guru, I would say, and without him, I don't think I would have gotten some of the opportunities that I've gotten here.
Each fellow has to choose, her project, and it's probably going to be research or QI or med ed, but they all are going to graduate with some excellent skills. They're all going to leave with very good critical appraisal skills. They're going to know how to understand the literature. They're going to know how to do a med ed project and current cycle and all of that. They're going to understand quality improvement, even if they didn't do that as their main project. They're going to understand the model for improvement and some Lean Six Sigma, and they're definitely going to understand research and biostatistics and things like that.
On the hospitalist side of things, working with the hospital medicine team, everyone is amazing and they want you to get whatever you want out of the rotation, so they're checking in with you constantly to make sure that you're learning and that you're feeling like you're autonomous and all of that too. But then even the subspecialists that you work with are the same way. They realize that I'm training to be a hospital medicine fellow, so they make sure that I get out of it what a hospitalist needs.
We get to work with some amazing physicians here, and they rotate with pretty much everyone in our group at some point, and we go out of our way so that they can see the different ways that people interact with families, different bedside manners, different ways that people practice. They get to learn from so many different people, and while doing that, find their own way of managing and taking care of patients.
Jacksonville has been really surprising to me. I think it's an amazing city to live in, an amazing city to raise your family in. I think it's super affordable.
There's a lot of culture, there's a lot of young people, a lot of outdoors. City of Jacksonville is, I can't recommend it highly enough.
I wanted to live near the beach, so I live a little bit further from the hospital so that I can go to the beach whenever I want, and the hospital itself is absolutely gorgeous. It's right on the river. There's not a lot of places that you get to work, especially in the medical field, where you get to sit and look at the river and dolphins swimming in the river during your workday. So it's hard to beat that too.
I'm gonna be obviously finishing up and graduating soon and moving back home to Houston to start as an attending, but everything I've learned here will make me super successful in an academic hospital, and I feel very comfortable with my clinical skills and all the knowledge I learned from here and bringing that to my other institution.